Welcome everyone to the Elixinol webinar about cannabidiol and its effects and benefits. This is sponsored by Elixinol, and I'd like to give you and drill down into some of the important details about heart health with cannabidiol. I'm going to go into an extensive review of some of the extraordinary potential that cannabidiol offers in helping and maintaining the health. And I'm really delighted to be addressing this subject because it's so important and it's such a big factor. We'll try to run through this quickly, but as thoroughly as possible. Well, today we're going to discuss heart disorders and the burden of disease. And it's going to be generalized, but I'm going to have to focus on atherosclerosis and coronary artery disease as the main topic. But understand that this also extends further to congestive heart failure and to other diseases and disorders of the heart. I'll talk about some of the conventional causes and the treatments that are currently felt to be important in heart disease. And we'll talk about the endocannabinoid deficiency that is characteristic of this disease, as it is true in many others. There's a significant amount of evidence for CBD benefits, and I'd like to go over some of those. Then we'll talk about suggested serving sizes and management of patients, and I'll follow it up with some references and a question and answer period. So when we're talking about heart diseases, we're really talking about a spectrum of disorders, a broad range of conditions that are affecting people in many ways. Of course, the leader is the coronary artery disease. We're well aware of that and the importance. But we're also talking about heart failure, and that can be a distinctly different and independent type of problem, as well as looking at arrhythmias and the different forms of ventricular and atrial rhythm problems that disturb the cardiac function and cause a great deal of impairment and great deal of expense. Of course, we're also talking about some of the cardiomyopathies that go on with dysfunction of the cardiac muscle, whether it's due to degenerative conditions or toxins or for unknown reasons that we really don't understand. And that also includes some of the viral infections like the Coxsackie virus, which causes a cardiomyopathy and a disability and impairment. All these things are important, but we're going to have to focus on the coronary artery disease portion. So if we're talking about the burden of disease, we're talking about a huge population of Americans that are faced with this condition. And I show here on the right a map of where that heart disease is focused. So you see a real concentration in the southern United States, loaded with disease, and it matches fairly closely to diabetes and obesity and to many other disorders. In addition, there are 750,000 heart attacks that are occurring yearly, and the total cost of this is, as of 2010, was $444 billion. I'm sure that has stretched up quite higher than that. In addition, one of the income discrepancies is that the people with the highest risk are actually in the lowest income areas. And that's a little bit counterintuitive when you think that they are the people who are maybe eating the least number of calories, and they should not be eating perhaps the high-fat, expensive, luxurious meals, and yet the people in the lowest income are suffering the biggest impairment as a result of this disorder. Speaking of which, there is impairment. We're talking about people who have had 1 or 2 heart attacks and then they're not able to work any longer. So they're out of the workforce, they're not able to do their jobs, and not able to take care of their families. And then those kinds of people end up within a chronic disability situation, and taxpayers are paying for their care and their services and their lifestyle. So if we're looking at the pathways of disease, and classically we've talked about this in terms of atherosclerosis, then there's vascular instability and electrical irritability that occurs, and we're talking about inflammation of the endothelial cell, the cells that are lining the vascular tree in the cardiac tissue, as well as the brain and other areas. In addition, platelets and the platelet aggregation and coagulation is a big factor in this pathway of disease. Now, to this point, we've been talking, most of the conventional approaches to disease have really looked at atherosclerosis and the mechanical obstruction of the heart vasculature as being the main cause of the heart disease and the cardiac events that we see. That may not be entirely true. In fact, that's just a theory, and although it has substantial logic and there's some substantial evidence, it doesn't always follow through that that is in fact the case. There may be other factors that are involved here. We're talking about conventional treatment. We're looking at coronary artery disease, and we're seeing rate-limiting beta blockers, vasodilators to open up the blood vessels, antiarrhythmics to reduce the electrical activity, anticoagulants to thin the blood and prevent that coagulative clot that forms that may be blocking the blood vessels and the arteries, that leading to ischemia. And then in terms of therapies, we're looking at statin drugs as being the key and the most important and widespread use of, as well as looking at the surgical solutions, the stents and bypasses, which are truly billions of dollars and a huge, huge business going on. But I want to get back to some of the causes and some of the sources and talk about the endocannabinoid system, because when you get right down to it, there's strong evidence to show that the endocannabinoid system is dysfunctional in cardiac disease, as well as many other conditions, but in particular atherosclerotic, as well as other kinds of heart disease. Probably the endocannabinoid system is in the shadows. People aren't aware of it. There is very little awareness. I would estimate that less than 2% of physicians really know anything about it. And yet this is a pervasive system that has so many controls on how our body works and function, including the cardiac function. There's clear clinical endocannabinoid deficiencies, and we even now call that as a clinical endocannabinoid deficiency syndrome in a number of different problems. Now, the causes for this endocannabinoid disruption can be diet, can be drugs, and it can be toxin as causes. Infections can also lead to disruptions and trauma. Now, I want to mention here about restoring the endocannabinoid system. That's what we've been doing with many of these therapies. The standard drugs, as well as the diet, exercise, meditation, all work to restore the endocannabinoid system. They just may not be enough. And what I'd like to propose is there may be more that we can do to help the endocannabinoid system recover and improve the outcomes from cardiovascular disease. Now, if we're looking at endocannabinoid system deficiency specifically in heart disease, and there's good evidence for this, we're talking about typically an excess number of cannabinoid type 1 receptors that are populated. That seems to be a signal when the body is under stress or inflammatory conditions. There's also evidence of low anandamide. That's one of the most prominent of the endocannabinoids. And all of this leads to an increase. Let me correct that. I want to say that oxidized LDL, the famous and what we've discussed as the terrible LDL problem that we have and the hyperlipidemia causing LDL, it may not be just the LDL, it may be the oxidized LDL, and that clearly has signals that increase the number of cannabinoid type 1 receptors in the inflammatory cells and the macrophages, as well as the endothelial cells. And that action by the CB1 types of receptors leads to increase in the cytokines, the inflammatory substances that signal our body to attract more lymphatics and inflammatory cells to an area. And the stimulation of the cannabinoid type 1 receptors has been shown clearly to be involved with atherosclerosis. On the other hand, activation of the cannabinoid receptor type 2 has shown a decrease in atherosclerosis. And it could be that a combination and an endocannabinoid approach might be able to rectify this situation and restore people to health. Now, at this point, I want to talk a little bit about cannabidiol. I know you're familiar by this time with cannabidiol, knowing that it is from cannabis, that it comes from the two major types, the marijuana and hemp, and that cannabidiol is really coming from the hemp side. And CBD is what improves health, and the THC may make you high. CBD is safe, it's legal, and it's effective, and doesn't cause any significant reactions, toxicity, or interactions. And CBD also helps to restore the endocannabinoid system. We're talking about adjustments in the cannabinoid receptors, type 1 and type 2, as well as interactions and modulations of those cannabinoid receptors, as well as the endocannabinoids, those signaling molecules that are going out to give directions to the body for the action that it needs to take in the case of disease and disorders. Now, CBD effects on the heart are quite profound. Number one, there's clear evidence that cannabidiol will protect ischemic cells. And studies have shown that in trials of animals who have had their arteries ligated, have been able to protect against the large amount of ischemia and cell damage. It prevents those ischemic cells from dying. It allows them to stay alive and to continue in a functional capacity. I'll show you some slides about that a little bit later on. In addition, cannabidiol is working as an immune modulation system because what it's doing is reducing the cytokines. It's reducing the inflammatory reactions that are typically occurring and that seem to be pervasive in this disease as well as many other diseases. It's anti-inflammatory. And I want to call a distinction between the anti-inflammatory and the immune modulation, because in immune modulation, we're talking about the population, the number of macrophages, the inflammatory cells, the ones that come into an area when a tissue is injured. These cells are being decreased. You don't need to have them around, and the cannabidiol is actually reducing that population. So you're getting a reduction of inflammatory substances, not only from the reduction in cytokines, but also from the reduction in the number of cells that are active in an area. In addition, you're seeing vascular relaxation. We're talking about smooth muscle relaxation that is in the arteries. So you're getting a relaxation of some of the blood pressure, but you're also preventing spasm. And that's one of the areas that is in some contention, because there are people who have heart attacks who have no cardiovascular disease in terms of atherosclerosis. And spasm can play a major role, and it's thought that that may be a precipitating role for many people, even with atherosclerotic plaques. Furthermore, there's evidence for CBD that is affecting the platelet adhesion, not in a negative way, but in a normalizing way. Instead of the hyper adhesion that may occur in the clot formation and the tendencies there, what we're seeing with cannabidiol is a relaxation of that, a normalization. So you're not getting that tendency to form adhesive clumps that lead to clot formation and the pathways that proceed along that way. In addition, we've got cannabidiol working as an anti-atherogenic molecule, signaling the body, reducing inflammation, reducing the formation of plaque, as well as atheroma. And that's been shown in animal studies very good clearly. Now, if you're looking at cannabidiol, what does it do directly to the heart? I mentioned that there is some relaxation of the blood pressure, but a relatively minor amount. And uniquely, cannabidiol typically does not reduce blood pressure in people who have normal blood pressure, but people with high blood pressure, we're seeing some corrections in that particular area. In addition, cannabidiol is working not to increase the heart rate, but actually it slows it down slightly. So you're getting a better cardiac output from the relaxation of the blood vessels and the contraction of the heart rather than a compromise in the heart function in whatever manner. Now, let me show you some slides of what happens when you take an artery and you ligate it in the heart, and what happens. In the first image there, you see this is a cross-section of the ventricle of the heart, and what you have is after ligation, you can see the ischemic areas in white, and contrast that with those animals who were treated with cannabidiol immediately before and shortly after the ischemia as a result of the ligation of the artery. Dramatic reduction in the infarct area as well as the area at risk that's in the rest. Impressive results coming from this, and I think it bodes well for the use of cannabidiol in cardiovascular emergencies as well as prophylactically. If we're talking about the cellular effects specifically, CBD quenches the reactive oxygen species. Those are the ones that are doing a lot of the damage and signaling the cardiac cells as well as other tissues to go into a death spiral. So that area is being protected, and that's probably why we get better survival in those cardiac tissues. We're seeing enhancement of the mitochondrial function. So the cells are working better, their energy function is improved. It's preventing cell death, and it's shifting the lipid profile. It's modifying the hyperlipidemia and improving the way the body produces lipids and provides those lipids in areas of healing as well as health. It shifts the glucose profile so that it's reducing the number of glucose receptors and improving the insulin sensitivity of tissues and of cells. Now, one more thing I want to talk about is that is statin drugs versus cannabidiol. Looking at statin drugs, they sound like they are a utopia with all of the positive things that are being done. But I'm very much concerned about that, the fact that many of the adverse effects are being glossed over and ignored. There's evidence for as many as 30% of people who take the statin drugs having adverse reactions. And I have seen at least 15,000 deaths related, at least in part, due statin use. Now, statins are touted as the solution, but in fact, the studies that were done with statins only show a 3 to 5% death reduction after 6 years of use of taking those pills. How do they work? I mean, classically, we're told that it reduces the cholesterol, but that is in great deal of question whether cholesterol reduction in itself prevents and avoids cardiac disease. In fact, they are superb anti-inflammatories, and that probably is the mechanism that's involved because it's a non-linear relationship in terms of the amount of drug and the amount of protection that is going on. So more than likely, the anti-inflammatory is a key component. But worst of all, we're seeing statin drugs are involved with a total pathway inhibition of the mevalonate pathway that is so critical for normal functioning in the body. Now, I want to contrast that with cannabidiol that shows extraordinary neuroinflammatory modulation. It reduces atherosclerosis, whereas statin drugs do not reduce atherosclerosis. It's cardiac protective in ischemia, and it's got whole body benefits, and there's no adverse reactions that are associated with it. There's quite a contrast, and I hope we have more evidence and clinical studies of the use of cannabidiol so that people can start using this and physicians will start employing it as part of their therapy. In terms of dosing, I like to start with a standard dosing for most patients, and that is to start with 15 milligrams twice a day and adjust the dose to meet the particular needs of the the patient, and to control the symptoms that they're having. There's several different forms, including liposomes that are in a water-soluble format. The duration of action is anywhere from 6 to 12 hours, but I think for cardiovascular disease and the benefits that we're seeing metabolically, I think you can look at 12 hours as being a very reasonable approach and dosing pattern. Now, I would say the target dose depends on the severity of the problem, but typically for maintenance and prevention, 30 milligrams a day, and then for more severe conditions, I would look at 60 milligrams per day. Now, who should be using CBD? Well, I always like to focus on those patients and those whose symptoms are unresponsive, those who are at very high risk or have toxic levels, and those with impaired organ functions of any kind, because we know that many of the drugs that are currently being used are toxic and they have many adverse consequences. If you're looking at other types of problems, and there may be some crossover to difficulties like neuropathy, brain injuries, Crohn's disease, Alzheimer's, chronic narcotic use, there's another number of advantages for people who have those particular problems as well. So let me just go over some of these things and remind you about what we've discussed here today. We're talking about the huge burden of heart disease and the satisfactory but marginal improvement that we've made with conventional therapy. I'm discussing the endocannabinoid deficient that's common and could hold the answer for a lot of the problems that we're facing and the ability to make some much greater progress in controlling this pervasive disorder. CBD addresses all of the pathways for cardiovascular disease, and CBD is supported in preclinical studies and in practice. So there's no adverse effects, toxicity, or drug interactions, and dosing is really quite modest with fast results. Immediate results can be obtained. So at this point, I want to open it up for questions and discuss some of aspects that you have concerns about and you'd like to know more about. I've listed off here some of the references that I have. You be careful about copying the references because it is in a peculiar format, but they're all posted on Google Documents and they are available for your review. In addition, I've got an article that I wrote on statins versus cannabidiol, and I've got an overview of cannabidiol in general about something that you could use for patients or for patient education. I've taken the slides for this presentation and I've put them onto the website as well, so you can download and take a look at the slides and review some of the items that I have talked about here. I'll be happy to take your questions. If you don't have any at this time, perhaps we can meet up and we can have some more conversation or get your questions answered in the future. I'd love to be able to meet your needs as medical professionals to be able to get this therapy out to patients so that we can improve their health and avoid the suffering that they're constantly undergoing. Question is about the use of statins and CBD. Yes, I think that could be an excellent combination because some of the adverse effects that statins have might be able to be prevented with the use of cannabidiol. One in particular complication for statins comes with a neuropathy that occurs and that's actually permanent. It may be that cannabidiol will prevent that particular neuropathy. However, if somebody's developing a complication from statins, I highly recommend that they discontinue those statins. And I think that everybody, all of the providers, should be aware of the potential for significant adverse effects from the use of those drugs. Thank you very much for attending with me, and I look forward to seeing you again.